Assalamu alaikum everyone. Welcome back to my channel. This is Dr. Zina speaking. Today we'll be talking about what are benzodiazepines. But before we continue, make sure to smash the subscribe button down below because it would really help me to grow my channel in order to reach many dental students worldwide. So let's start now. Let's start with defining what are benzodiazepines. They are depressants that produce sedation and hypnosis, relieve anxiety and muscle spasms, and reduce seizures. Or in other words, the benzodiazepines are sedative, they are hypnotic, which are sleep inducing, anxiolytic, reduce the anxiety, anticonvulsant and muscle relaxant properties. These are the main functions of the benzodiazepines. Now, what is their effect on the body? Benzodiazepines, they slow down the central nervous system and may cause sleepiness and relaxed mood. So the common uses of benzodiazepines, number one is for anxiety disorders. These are the most common prescribed drugs by the psychologist for patients because they are anxiolytic. They reduce the anxiety. Not only that, they are useful for insomnia. What do I mean by insomnia? Meaning that if you cannot sleep at night, so the best treatment to take is benzodiazepine. Number three, for seizures as well. If you are having continuous seizures, your doctor may recommend for you to use a benzodiazepine. Number four, for muscle spasms. And lastly, for medical procedures because they are hypnotic and sedative. So they will induce sleeping for the patient. So it's used basically under general anesthesia, the benzodiazepine.
In synapses where GABA acts as the neurotransmitter, an action potential releases GABA, which then opens a GABA receptor, allowing chloride ions into the postsynaptic cell. GABA is inactivated by being taken back into the axon terminal through the process of reuptake.
Summarize for you the mode of action for the benzodiazepine. The benzodiazepines, they work by enhancing a very important neurotransmitter. This is called GABA. GABA stands for gamma aminobutyric acid at the GABA A receptor. GABA is the chief inhibitory neurotransmitter in the mammalian central nervous system. Its role is in reducing neuronal excitability, and in humans, it is also responsible for the regulation of the muscle tone. So, if your nervous system was a car, GABA functions much like the brakes of the car. So, when the car takes off, speeding down the road, this is due to the excitability of the nervous system. GABA functions as the brakes to calm and slow it down. Now, which drugs cause similar effects? What do I mean by similar effects? Meaning that they are anxiolytic, they are hypnotic, they are sedative. These include number one is alcohol, because when you drink alcohol, you will have a sedative effect. Not only that, the barbiturates, they are also function the same as the benzodiazepines. They work by enhancing the GABA neurotransmitter. In addition to that, the sleeping pills, because they are hypnotic, they induce hypnosis. We have two categories for the benzodiazepines. We have short-acting and long-acting. The short-acting benzodiazepines, you can remember it by the word atom. Atom stands for alprazolam, triazolam, oxazepam, midazolam. These are the only four short-acting benzodiazepines, and the rest, example, we have diazepam, or the brand name comes as Valium. It is long-acting benzodiazepine. Now, there is a disadvantage associated with the short-acting benzodiazepines is that they have a high potential for dependence, misuse, and addiction. So there is a high chance that you will be addicted to the short-acting benzodiazepines. And you might ask me, why are the short-acting benzodiazepines more addictive in comparison with the long-acting? This is because that the short-acting benzodiazepines, they have a shorter half-life. This means that the drugs are processed and leave your body more quickly, right? This is what do I mean by short half-life. Short-acting drugs, they have a higher risk of withdrawal symptoms. This is because your body has less time to adapt to working without the drug once you stop taking it, and that is the reason why the short-acting benzodiazepines are more addictive. Whereas benzodiazepines with longer duration of action are utilized to treat insomnia in patients with daytime anxiety, and these include alprazolam, clorazepate, and finally diazepam, and many others as well. All benzodiazepines are metabolized by the liver. So if you have liver problem, like if you are having inflammation of the liver or hepatitis, it is contraindicated to be given any class of the benzodiazepine. You might know the drug diazepam because it is commonly used in the management of alcohol withdrawal symptoms. Benzodiazepines should be used only for the shortest amount of time possible. Taking benzodiazepine regularly for a few weeks or more can lead to addiction. So doctors recommend that you only take them for 2 to 4 weeks. Intermittent use also may help to avoid addiction. What do I mean by intermittent use? Meaning that day, yes, you can take benzodiazepine. Day, no, don't take a benzodiazepine. So day by day, so that in order to avoid addiction at the end. And the overdose of the benzodiazepine might lead to low blood pressure or hypotension, weakness, drowsiness, confusion, dizziness, inability to talk or respond. So be careful. Don't overdose yourself with benzodiazepine because it is life threatening. The patient might die because of overdose.